Welcome back, awesome mommies. There is a silver lining to every dark cloud. Amidst this COVID pandemic, many work from home mommies are actually getting an opportunity to breastfeed their children. However, what bothers them is, am I making enough milk? So why do mommies self-suspect? Immediately after they feed a baby and they put the baby down, the baby cries. So they kind of end up thinking that the baby was not well fed. However, the actual reason could be a gassy child or a regurgitation or something like that. So today I am going to quickly run you guys through the signs of lactational insufficiency so that you can self-assess yourself at home. Frequency. First of all, how frequently are you feeding the child? If your infant is less than 6 weeks old, are you waking up the baby once in every 2 hours and feeding him? Close to around 8 to 10 times a day. And if your baby is more than 6 weeks old, that is more than 1.5 months old, then are you feeding the baby on demand? Even if the baby is awake throughout the night, there is no need to wake up the baby. The feeding can be done purely on demand basis and it has to be close to 6 to 8 times per day. Then, is the baby sleeping well after being well fed, say around 2 to 3 hours after each feeding? If no, then are you burping the child well for a minimum of 15 to 20 minutes after each and every feed? Some babies fall asleep while they are taking a feed and mothers don't want to bother the child and they immediately place the child down. Babies swallow a lot of air along with breast milk. This is called as aerophagia. All the gas in their stomach makes them very uncomfortable and they wake up, say within 30 minutes after feed. They may have to spit up or vomit, or they cry because of the discomfort or the pain in their tummy. Mothers end up thinking that the babies are not well fed. That is not true. That is the reason why I am emphasizing once again that the baby has to be held upright and patted on the back so that all the tiny bubbles of the gas that is there inside the tummy, they coalesce, they form a big gas bubble and it's easier to burp. Or make the baby sit in your lap and support the neck very well and gently rock the baby in your lap. That as well causes a tiny pressure over the abdomen and it's easy to expel the gas. The next most important question to look at is, how many times is the baby passing urine per day? If the baby is passing 6 to 8 times urine, which is light colored, please consider by all means that the baby is well fed. If the urine is deep yellow, it could mean that the baby is either jaundiced, or if the baby is not jaundiced, then it could mean that the baby is dehydrated or that the baby doesn't have enough water or milk in his body. That is where the mother is supposed to focus on her water consumption as well. A feeding mother in general is required to take a minimum of 5 liters of water per day along with milk and other liquids. Coming to the stools, it's quite variable. Say a newborn baby may pass up to 10 stools per day. This is called as gastrocolic reflex. That means soon after the baby is fed, the baby passes stool and empties the bowel. Sometimes they may not even empty the bowel. The quantity of the stool could be quite less. They would just soil the diaper. This is called gastrocolic reflex and this is not diarrhea or something. And this is actually a very good indicator that the baby is well fed. So what about babies who are not having gastrocolic reflex? It just means that the bowel habit of these babies are different. Some babies empty their bowel once in every 2 to 3 days. Well, this is also normal. What I would want you to focus upon is there a recent change in the bowel habit? That means a baby who was passing stools very frequently, has suddenly stopped passing stools and not passing stools or passing very hard stools, then probably the baby is not being well fed. Mothers can consider taking a little bit of fiber diet, say greens, mangoes, bananas, papayas, oats. Oats especially are good galactagogues. That means they increase the milk production. And then if the baby's bowel habit is not resolving, then they may consider seeing the pediatrician. The final and the most important indicator of adequacy of breastfeeding is a very good weight gain. If your baby is less than 3 months old, the baby is supposed to gain 30 to 50 grams of weight per day. And if the baby is 3 to 6 months old, the babies usually gain 10 to 30 grams of weight per day. If the answer to all of the above questions had been yes, then pat yourself on the back, mommy. You're doing a great job. And sometimes mothers who are actually lactating well come to us at around third month or something like that, saying, oh, we don't experience the heaviness or the firmness of breast that was there earlier, and we kind of feel that the secretions have gone down. Well, the body learns to adapt. It learns to drain the breast better, and it tries to make you feel comfortable. Just because you're not able to feel the heaviness or the emptiness of the breast after the baby is fed, it does not mean that the supply has gone down. Finally, there are these mommies who are anticipating to go back to work. They experience a sudden and drastic fall in the supply of their milk. Their babies are not urinating well, their babies are fussy and not crying all the time, and they are not gaining weight, they are not passing their stools. So my advice to these mommies is relax. You can still salvage the situation. What you're probably thinking at the moment is that you want to be prepared just in case when you are away and the baby is hungry, what to give to the baby. You would probably want to introduce the solids early, or you would probably want to be prepared with plan B and have a formula ready at home. Well, mothers, you can always give them your expressed breast milk. How to do that? Please buy a breast pump and take a lot of water. Earlier I said a feeding mom needs 5 liters of water per day. If you are planning to express milk and if you are experiencing secondary lactational insufficiency, probably you can push your limit a tad bit and take 8 liters of water per day. And start pumping once in every 2 hours, even if it is an empty breast, even if there isn't any supply. What are you actually trying to do here is you're trying to send impulses to the brain saying that, hey, there's a lot of demand, you better increase the supply. So once you're pumping, by around 3 to 5 days, the supply goes up. Please take all the galactagogues, that means the foods which increase the lactation, and keep on trying to express the milk. Once the milk is expressed, you can give the expressed milk in the room temperature within 6 hours, or you can refrigerate it and use this milk within 24 hours, or you can take a breast milk storage bag, mark the date with a permanent marker, and put it in the deep freezer. Use it anytime within 3 to 6 months. How to use it? Never heat breast milk. You can either thaw it, that means you can leave it in the room temperature and wait until it's melted, or you can take a basin of hot water and take this breast milk bag and keep it around in that bubble for about 15 minutes so that the breast milk melts. Use this breast milk to feed the child even if it is slightly discolored. It may appear a tad bit more yellowish, but that does not mean the breast milk is spoiled. If the breast milk is spoiled, it would smell very sour or bad, or you could see that the milk is actually broken. That's when you can discard the breast milk. If you are a strong, independent and motivated mommy, your baby is no less. She will support you to work while feeding on your expressed breast milk when you are away. Happy breastfeeding, happy parenting.